in the chat. That will be useful so that we get to know the representation.
Okay, from Vanuatu. All right, so I think I can start now. Let me share my screen. Can you see the slides now?
Yeah.
Yes. Yeah.
All right, great. So welcome everyone to the module 3 of the data quality course. I hope you had a good weekend and that the assignments that we had given you last week went well. So today, so here you can see a bit of the table of content of the vital statistics reports template that we encourage you to complete throughout this course along the modules that we present you. And so to give you an idea of what we are covering, so last week we covered a bit of the data sources and of data quality, and this week we're going to continue on data quality, and we're going to also see timeliness of registration and especially completeness of registration. Wait. Sorry, I'm having some troubles with the presenter mode. Sorry, can you see my screen now?
Yes, we can.
Yes.
All right. Yeah. Sorry. Having some problem. Yeah. So we will see the second part of data quality and see on timeliness and completeness of registration. But first, we wanted to reflect on the assignments that we asked you to do last week. So here is a presentation of some of the essential tables that we would ask you eventually to do on birth. The two that we had asked you to try and do last week were the total number of births by year and total number of births by year and sex. So to make sure that we're on the right slope of difficulty and that you didn't face too many challenges, and it was a useful exercise. We wanted to reflect a bit on this assignment. So for that, I would encourage you to go to Mentimeter. So you should see here the QR code or the link, and my colleague will also share the link and QR in the chat, through which you will be able to answer some questions. Okay. You can put it in the chat if you are having problems to connect.
Okay, so I think we can go to the first question.
Yeah. So the first question that we wanted to ask you was how difficult was last week's assignment? Did you find it very easy, normal, difficult, very difficult? You can put any answer. The answers are anonymous. It's just for us to know if those exercises are useful for you. Okay, so we have very easy, difficult. Okay, so not everyone agrees, which is fine as well. So no problem with that. All right. I guess we can go to the next question then. So the second question was, what did the assignment help you understand about your data? So it's an open question. You can write anything. It's to know if you realize something about the quality of the data that you had, if there was any specific issues, if it didn't include some kinds of birth, or if there was more years than you thought, less years than you thought. Some things like this. It's since we're doing this data cleaning exercise also to help you better understand what is in the data that you have on your hands. Yeah, we'd like to know if you realized anything specific from cleaning and tabulating it. Again, the answers are anonymous, so you can put in anything you want. All right. Different ways of entering the location of death. Yeah. Yeah, indeed, that is. I'm not sure which country said that, but it's something that we noticed also on some of the files that we've received. Is there was no standard for writing some of those variables, especially on the place of birth or place of death. Many missing data inside the data set that we have. Example, date of birth. Especially when it's important variables such as date of birth, it can be a bit problematic, but hopefully realizing that there are those missing data can maybe also help you help your country improve the data collection system. So we have causes of death not coded, which is very important, of course. We won't be touching specifically on causes of death during this course. But yeah, if you want to produce a vital statistics report, you would definitely need causes of death to be coded somehow. So that is also something that you can reflect on for the data collection and spelling, which I guess is also linked to different ways of entering the location of death. Okay, so thank you for those answers, and I think I'll continue with the presentation. All right. So on to continue a bit on data quality and something not exactly data quality, but that is related, especially since we asked you to produce tables last week, which is guidelines for publishing tables in reports. So there are a few of those small tips that we have to tell you, like what is the best way to present numbers in the tables in the report so that it's intelligible and instantly understandable by the readers. So some of these tips are very basic, but it's just to have for you to have a reference of what you need not to forget when having those tables in a report. So first, you need to have a reference for the table, usually a table number, and a clear title to go with it to explain what's the content of the table. You should space the table entries so that it's not cluttered, and you should provide a total row or column to provide some summary information, especially when we are talking about percentages. Other tips are to include the source of the data at each table so that you can just see that and know where it's from. Have the rows and columns clearly labeled, and use some horizontal bars to separate the labels from the data themselves. But usually we try to avoid having bars between each entries because it also makes it harder to read. Some tips. And some other tips are to specify the units of the data in the table. Also to put the numbers are most likely to be compared with each other in adjacent columns and not adjacent rows, because that's just how most people read information is horizontally. So you want comparable number to come across columns, for example, like total number of birth across years. It's preferable in columns rather than rows. And when you have percentages, it's important, as we'll see, to round these numbers to reduce the information, to usually just have one decimal point so that it's clear from just from one look what the number is. So on percentages, also again, something that most of you probably know, but just a reminder of some general principles and on do's and don'ts when having percentages in a report. So percentages is to change an amount by dividing by its total and multiplying it by 100, and you should not show the raw figures, but you should round them to one decimal or even to integer. And quite often when you present percentages, it can depend a bit what is the indicator, but you want the total, if it's supposed to represent all of your cases, to add it to 100. And in that case, that's called a percent distribution, which you should put in the chart title. And you also want to put in those tables the equivalent of 100%, like how many, if it's a number of births, you want to put how many total births occurred that those percentages refer to. So okay, that was for some basic overviews of what to do with tables in reports. And now to get to a bit more specific principles. There's the question of aggregating data over time when reporting. So when we're computing indicators, there are not simply number of events. So for example, completeness, as we'll see later today, or fertility rates, mortality rates, as we'll see in later sessions. Single year data is likely to be a bit unstable, especially with countries when the population is small. And therefore, it's not recommended, and especially if you want to disaggregate some of those indicators by sex or age groups or some other variables that make the population of reference even smaller. So for that, the minimum aggregation to remove a bit those random effects that make the data change across years. The minimum aggregation would be 3 years, but sometimes 5 years may be more suitable, especially if the country is smaller. And derived from that is the fact that sometimes annual reports are less useful than having a detailed report every 3 years or 5 years. So that you don't over-interpret some small trends that actually are not reflective of an actual trend. So it's a bit on a case-by-case basis, which aggregation should you use, and you can refer to us if you are having some doubts or on specific exercises later when we see how to compute fertility rates. But it is preferable to have the same time period for all indicators when to choose one. And now we'll take you through some general principles of data quality that you should apply when you're tabulating your data to check if there could be some problems on how it's working. So the first of those would be consistency. So consistency would be the fact of having the same numbers, or at least the same trends across years or months. So if your data doesn't follow similar patterns from year to year, month to month, that could be a lack of consistency. So if your number of births suddenly peaks or suddenly drops from year to year without any specific explanation that would explain it, it could be a sign of a lack of consistency in the data collection. So to assess those, that's where the tabulations that we've already asked you to do last week and that we'll ask you again to do in the coming weeks are useful, because you have the total number and you can compare across years if there's any weird trends. And it's generally good to examine those results also by subregions, or to see if there could be problems in specific parts of the country. But that being said, the small populations in Pacific Islands can sometimes create random effects that does not mean that the data is of bad quality. It just means that it varies quite significantly, sometimes across years. And that's also why you should be aggregating data to minimize those random effects. And the question of consistency poses also the question of reliability, which is your CRVS system able to produce results of a similar quality over time? So again, it's a bit difficult to assess. It can be difficult to have a clear-cut answer, but doing a lot of tabulations should help you gain a bit more insight on this. Then there's a very important principle, which is the question of coverage. So coverage is the area of population that the data set includes. And it's important because sometimes in collection of civil registration or hospital data sets, there can be at this level it's supposed to represent the entire country, but sometimes there can be parts of the country or groups of the population that are missing. So for example, if you're working from health data and that on one of the islands there's no health center, maybe the events occurring on that island are not included in your data sets. And that can create a problem because then you have a blind spot. You don't know what's occurring there. And it can be also hard to spot depending on a variety of factors. So again, that's where doing as many tabulations as possible and trying to really read them and understand what's occurring could help you spot some of those problems. And coverage is linked also to representativeness, which is how well the data you collected reflects the broader population. So if you're not covering your entire population, then you're going to have problem of representativeness. And again, that's if you're working from health data and your death data set doesn't include death occurring at home, for example, then it means that you just have the death occurring in health centers, which are different in general than the death occurring at home. So, and those issues can create a bias in the data collection, which can then skew the analysis and create some problems in the analysis. And the last principle I wanted to talk you through is that of data validity, which is the plausibility of the raw data. So there are a number of ways that you can see if your data is not plausible. There are some general truths that should be observed in your data. For example, it's implausible that infant mortality rates would be substantially different for males and females. And if some of those observations do follow those implausible or impossible trends, then it means that there is a problem in the data collection or in the data sets. And the best way to do this would actually be to compare two sources, ideally. So if you have comparable sources, for example, from civil registry and the health system, you can compare them to see if there are some of those demographic indicators that are completely different across sources. That's also a sign that something is wrong with at least one of the two data sets. Or if you also have the results of a census or household surveys. And then if you see those differences, you should attempt describing the differences and try to reconcile them by maybe determining which sources seems the most correct, or where do the two differ. And finally, I wanted to touch on something that is quite specific to the Pacific, which is off-island events. So as all of you know, in many countries in the Pacific, there are some vital events like birth and death that can occur in a country where people are not residents. So it can be a mother going abroad to give birth, or someone seeking care in a hospital abroad. And those birth and death that occur off island or of country can impact the measurement of some indicators such as fertility, mortality, or causes of death. It's, of course, it's like it can happen in any country, but it's more likely to impact countries with smaller population. And that's why it's often something that needs to be agreed on before you start reporting on and tabulating your data. And we don't really have a solution to this question. We're not going to ask you to do it the way that we want to, but we just want to make sure that you reflect on this and that you are aware of the standard for data collection and data reporting that exists already in your country. Like, have there been some vital statistics report before that have been reporting on the separately on the number of events occurring to residents occurring abroad, or on the number of events occurring to foreigners occurring in the country? And if there is already a standard, you should also apply it after. The only thing is to stay consistent and to properly record those data differences to make sure that you're able to differentiate during analysis. And just on this, we also, again, wanted you to ask you some questions on Mentimeter. So if you go again, it's the same link that is in the chat. You should, if you click the same link, you should access the next questions that are on those off-island events. So the first question is, does the Civil Registry have a special procedure for vital events of residents occurring abroad? Yeah, normally they should, but it's just to know also if you are aware of those standards. It's all right if you don't know as well. But maybe you might also have noticed it in the data sets that you cleaned last week. Maybe there was some variables about birth occurring abroad or something like this that could tell you those events are included. Okay, so we have 1 yes, 1 no. I'd be interested to know which country answered no, if you want to speak or put it in the comments. Otherwise, I guess we can. So I saw Pila. Is it Vanuatu that doesn't have a procedure to register events occurring abroad? Okay, I guess otherwise we can go to the next question, which is, how does the National Statistical Office report these figures? Do they separate the number of events occurring to residents abroad, or the number of events occurring to foreigners in your country? And you know what they include in which reporting? It's an open question. You can put any consideration that you have. Okay. So if there is through census, but in the census, do they separate the events that occurred abroad and in the country? No, and you're not expected to speak, but to write a comment in the question. But if you want to speak, that's okay as well. Yeah, please, Samuel, you can speak.
Hello for everyone. Thanks for the opportunity for Samuel to share experience. In terms of the first question, yes, we have a procedure. We have we are mandated under the Births, Deaths and Marriages Act 2002, whereas that we registered births and deaths and marriages that occur abroad, but not births. We only mandated to register the births that occur within Samoa. But there is a chance that the Samoans who were born outside of Samoa are currently carrying a Samoan birth certificate, and that's through the legal adoption process. But in terms of deaths and marriages, if there's like you are Samoan and you passed in New Zealand, or you get married in New Zealand or elsewhere, you are allowed to register that event in Samoa. We have Samoan consular's office in various countries, especially New Zealand, Australia, US, and then Samoans, they can get through those Samoan missions office, or they can send the papers to our office and send a relative or someone, close relatives, to register those events. In terms of reporting, there is no separate platform of reporting events occurred abroad and events happening here in Samoa, but we do register, and if we report it together as I mentioned before. We don't report separately. Thank you.
Okay, thank you very much. That's very interesting. I see the comments of Vanuatu in the chat, but if there's no other comments, I think I will hand the floor to my colleague Chloe to take you through registration completeness.
Thanks, Ruby, and good morning and good afternoon, everyone. So today I'm going to talk a little bit about registration completeness. And I'd like to start by asking you if you know what registration completeness is. So I'll ask David if you could kindly display the Mentimeter question on the screen, please. And you can use your phones again to answer this question. And don't worry, all responses are anonymous, so we can't see who's who.
Yes, so you can use your phone and take a picture of the QR code, or go on mentimeter.com and enter the following code 79834899. There's also the solution if you want to use your laptop. You can click on the link we have in the chat, and let me just repost it so that you can access the question.
So what do you think registration completeness is? There's no wrong answer. It's not a test. We'd be happy to hear your answers. Okay, I think we can move on with the slides, and we can go on to talk about what registration completeness is. Oh, hang on, there's an answer. When a birth has been submitted to the civil registry with all required information. So we'll go on to talk about the different types of registration completeness in a minute. When there is enough data recorded. Okay. Thank you very much. So I'll share my slides. Sorry, it's taking a little while to load.
I can see it now.
Okay, great. Okay, we got there now. I hope you can all see the presentation. So when we talk about completeness, we are assessing the proportion of events that we intended to capture that were actually collected. In the context of CRVS, this can mean two things, as also somebody pointed out on the question that we just asked. So the first is content completeness, which refers to how complete and reliable the unit record data is for each variable. So whether there is any missing information for certain variables. For example, this could be the proportion of birth records that do not include the sex of the child, or the proportion of records that don't include information on the date of registration. And then the second type of registration completeness that we talk about is the proportion of events occurring in the population that are recorded. For example, if our area of coverage is births in the National Hospital, we would be interested in finding out what proportion of births in the hospital were recorded. The general rule for CRVS data is that it should be 90% complete when used for analysis without adjustment. Although we advise that it's always important to report the completeness for context anyway. So in your reports, it's important to make a note of the registration completeness and the content completeness. So why is it important that we measure registration completeness? Well, computing the registration completeness allows us to monitor the performance of registration systems. For example, it provides us with important information about how large the gap is to achieve universal registration and whether this gap is getting smaller over time. If possible, indicators of registration completeness can also be disaggregated by several variables to get a better sense of what needs improvement in the system. For example, is the coverage of birth registration lower for girls? or do some islands have lower registration levels? It's important to look at these patterns and try to identify the source of these occurrences where there is missing data, or where, you know, one subgroup of the population aren't having their births registered as much compared to another subgroup of the population. And to compute completeness, we either need a separate data source or of such as hospital records or census data, but we can also use estimates of the total number of events, which are usually based on modeled projections. And we'll give you some links later on where places that you can find modeled projections on national estimates of births and deaths. Once we have our alternative data source, which will provide a more complete picture of the total number of births, we can begin to compute the indicator for registration completeness. So you can see here in the equation at the bottom of the slide, we have our numerator at the top of the equation, which will be sourced from the civil registration data. And that's the number of registered births. And then the denominator at the bottom of the equation is the national estimate. So this is the figure that will be coming from hospital records or census data. This is the more complete data source. And if there are no national estimates available, there are estimates produced by the United Nations Population Division or by the Pacific Community, which can be used as the denominator. And the link to these alternative data sources is provided here in the blue box. Although not as critical as registration completeness, another key indicator of the performance of CRVS systems is the proportion of events that are registered over time, in time, so without delay. This time is usually the legally stipulated time within each country when a birth should be registered. For example, in Kiribati, birth registration should take place within 10 days and death registration within 5 days. There is usually a tolerance period in which registrations are considered late. And this is sometimes 1 year, but after this time, a registration will be considered delayed. And analyzing these delays can also provide very important insights on issues faced by the registration system. Okay, I feel like I whizzed through those slides. Does anybody have any questions so far about the things that I've just talked about registration completeness or content completeness? Okay. So before I talk, I'll go through the assignment, and then after that, I will share with you the vital statistics report template. So the first part of this week's assignment will draw upon your tabulations produced last week. So we would like you to have a look at these tabulations and see if births are consistent over time, whether the disaggregated tables show any trends for categories, for example, by sex. For example, are more boys registered than girls? And if anything is different than expected, we can discuss it together during the tutorials or over email. And then secondly, we would like you to see how complete your birth records are for key variables. So in this part, we want you to assess any missing data in your data set. And it would be great if you could calculate the proportion of individual records with missing date of event, sex, age of mother, and place. And then lastly, we would like you to find an estimate for the total number of births by year in your country from census or health record data, and estimate birth registration completeness by year. You can use the table from the report template to guide you, and I will be introducing this template in a minute. And we would also like to encourage you to start writing as you go along, just short paragraphs or sentences to describe what you've done to your data so far, any data cleaning, and to also to describe any analysis of the tables that you're producing as well, because it's a lot easier if you write as you go along while it's still fresh in your memory. So I'll just show you the report template now. I hope you can all see the document on my screen.
Yep.
Okay, great. So this template is really useful as a guide to writing your own vital statistics report, and it provides detailed instructions and examples of what should be included. So in some cases, you just need to fill in the gaps with your own data. And here you'll see some detailed instructions of how to use the template. And it also includes a table of contents of the analysis to be included in your report. So this is a helpful reference point. And you can see here that for each section, it provides several pointers to help with what to write in each section. So you can take a look at this in your own time, as I don't want to take up too much of your time scrolling through this on the screen. I don't want to make you dizzy. I just want to take you to the tables that we are talking about this week on registration completeness. So on page 23, these are the tables that we would really like you to complete this week, if possible. We can also work through these during the tutorials, or you can do it in your own time, and then you can send it to us to provide written feedback, whatever works best for you. So here you can just fill in the gaps with your data. That's totally fine. And I'll also be sending this template as an attachment in an email following this session, so that you will all have access to this. I think that brings us to the end of today's session, but does anybody have any questions about any of the topics that we covered today, or about the report template? Okay, I don't see any hands. So as always, please just drop us a message if you have any questions. We will be emailing you with the recording and the slides after the session, and I'll also be sending you the report template. And that is all for today. So thank you very much for your time. Thank you for attending. And we look forward to speaking to you throughout the week. Have a great week. Thank you.